People think FUE is newer, so it must be better. But newer does not mean better. It means different trade-offs. Hair transplant success is not about technique, it's about biology and planning. So, what FUE actually is? FUE removes a thin strip of scalp from the donor area. That strip is dissected under magnification. So follicles are removed with protective tissue around that increases survival in the right patient. So on the other hand, what FUE actually is? FUE removes follicle one by one using punches. No linear scar, but less margin for error. Each follicle stands alone, and once damaged, it's gone forever. So what is the real biological difference? FUE advantages are better graft protection, lower transaction when done well. It preserves donors' density for the future. The FUE advantages are no long scar, faster visible recovery, flexible harvesting patterns. Neither is universally superior. This is the scar issue, and that I think no one explains. For the FUE scar, it's linear, predictable, hidden, but you have to have long hair. FUE scars, there are hundreds of thousands of micro scar. It can permanently thin the donor area, visible when over harvested. So when they say no scar, it's marketing, it's not anatomy. Donor hair is a finite resource. You do not get unlimited donor hair. Once a follicle are removed, they do not regenerate. Poor FUE planning can destroy donor density, limit future surgery, create irreversible patchiness. This is permanent. So, blood supply matters more than numbers. Grafts don't fail because of extraction alone. They fail when blood supply is overloaded, when dense packing exceeds vascular capacity. Hair transplantation is actually a vascular surgery. Shock loss, the part people hide. Shock loss can be temporary and they can be permanent. Risk increases with aggressive harvesting, dense packing, miniaturized native hair. Patients deserve to know this before surgery. So, do hair characteristics matter? The answer is yes. Outcome depends on hair caliber, curl patterns, skin thickness, follicle exit angle. Same technique, different biology, different result. Let's say one word about the robotic procedure. Now everybody's talking about robotic. Robotic FUE does not mean a better FUE. Robotics follow algorithms. They do not feel the tissue resistance. They struggle with curly hair, angled follicles, scarred scalp. And here, technology does not replace judgment. So you would ask, what is the best plan? FUE plus FUT is often the best plan. This is not a binary choice. High-level planning often uses FUT first for density preservation, FUE later for refinement. That's long-term thinking. Remember this: hairline design is more important than technique. The hairline determines natural appearance, aging trajectory, revision risk, because a bad hairline cannot be fixed by better graft. Medication and stabilization. Transplants do not stop hair loss. So without stabilization, you chase loss. You burn donor hair. Surgery without medical plan is incomplete care. How about revision surgery? Revision surgery is harder. Second surgery faces scar tissue, reduced blood flow, fewer donor options. Your first surgery matters most. So who actually does the surgery? Hair transplant is real surgery, and if surgeon is not present, critical steps are delegated, outcomes suffer. This is Dr. BenMaamer. If you believe healthcare in America needs to change, hit follow.